Hey everyone, welcome back to my channel. Welcome back for another edition of health class. Today it's not the typical health class that I usually do because andito ako sa aking clinic room. And what we're gonna do today is we're gonna be discussing one of the most common women's sexual health concerns. Yes, I know, nag-discuss na tayo about men's sexual health in the past a few times. But today, we will be discussing about women's sexual health. So, to all the women out there and their partners, you need to know about this. You need to know about dyspareunia, or what we call painful intercourse. So, if you want to know more, please keep on watching. Hello once again, welcome back to my channel. My name is Ryan and I'm specializing in primary care, diabetes, men's sexual health, alcohol and drugs, and medicinal cannabis. Recently, a patient of mine consulted me because she is having painful intercourse. I won't gonna be disclosing any of my patient's information, but I'm just gonna tell you what painful intercourse is all about. In medical term, it's called dyspareunia. There are a lot of causes why women experience painful intercourse, and for women and their partners, they need to know what are the causes why women experience painful intercourse. Sabi ko nga, there's a lot of reasons why women experience painful intercourse during sex, and a few of them are certain illnesses and conditions. The list includes endometriosis, pelvic inflammatory disease, uterine prolapse, retroverted uterus, uterine fibroids, cystitis, irritable bowel syndrome, pelvic floor dysfunction, adenomyosis, hemorrhoids, and ovarian cyst. These are some of the common conditions or illnesses that contributed to painful intercourse amongst women. In the medical world, the medical term for painful intercourse is dyspareunia. D-Y-S-P-A-R-E-U-N-I-A. Dyspareunia, a medical term for painful intercourse, is defined as persistent or recurrent genital pain that happens just before, during, or after sexual intercourse. So marami itong symptoms. There's a lot of symptoms, and some of the common symptoms are pain only at sexual entry or penetration, pain with every penetration, deep pain during thrusting, burning pain or aching pain, throbbing pain lasting hours after intercourse. So if you experience some or most or all of those symptoms, better to speak to your doctor. Pag nararamdaman nyo ang mga simptomas nito ng painful intercourse, you should speak to your doctor for immediate treatment. Physical causes of painful intercourse differ depending on whether the pain occurs at entry or with deep thrusting. Emotional factors may be associated with many types of painful intercourse. So we're going to discuss about entry pain. It might be associated with a variety of factors. One of them is not enough lubrication. Sometimes nagiging dry ang ating genital area, and it's very important for women to have enough lubrication so that it won't be painful when a man penetrates the woman. This is often the result of not enough foreplay, a drop in estrogen levels, a hormone, after menopause or childbirth, or during breastfeeding can also be a cause. Certain medications are known to affect sexual desire or arousal, which can decrease lubrication and make sex painful. This includes antidepressants, high blood pressure medications, sedatives, antihistamines. It could be due to injury, trauma, or infection. It could be due to inflammation or skin disorder. Then there is a term vaginismus. What is vaginismus? These involuntary spasms of the muscles of the vaginal wall can make penetration painful. That means those muscles in the vaginal canal contracts, making it hard for the man to penetrate, and it's making it more painful to penetrate. Now we're going to discuss the deep pain. Deep pain usually associated with deep penetration, okay? And deep pain is associated if you penetrate the woman really deep, and that's caused the woman to feel pain. It might be worse in certain sexual positions. Causes include certain illnesses or infection, such as endometriosis, which is a common one, uterine prolapse, pelvic inflammatory disease, cystitis, ovarian cyst, hemorrhoids, pelvic floor dysfunction, irritable bowel syndrome, uterine prolapse, and uterine fibroids. Scarring from pelvic surgery, including hysterectomy, can cause painful intercourse. Medical treatments for cancer, such as radiation and chemotherapy, can cause changes that make sex painful. And then we're down to the emotional factors contributing to painful sex or dyspareunia. Obviously, psychological issues. We have anxiety, depression, concerns about your physical appearance, fear of intimacy, or relationship problems can contribute to a low level of arousal and the resulting discomfort or pain. Then we have the stress. Alam niyo ba na ang stress is a very big in medical world. Ang stress ay nakakaapekto sa anumang aspect ng health. Stress affects any aspects of health. Each one of us develops our own mechanism on how to manage stress. It is very important to manage stress because it won't only affect your sexual health, but also your general health. Your pelvic floor muscles tend to tighten in response to stress in your life. This can contribute to pain during intercourse. And the last one is if there is a history of sexual abuse. So with dyspareunia, there's a lot of treatments available. There are some medications, there are some therapies, there's psychological therapies, but we actually need to make sure what type of painful intercourse is happening with the patient. So with this particular patient that I've seen a few days ago, it's all about entry pain, no other symptoms. Masakit para sa kanya if yung partner niya is penetrating her. It's not about deep pain, it's not about during sexual intercourse. It's more on the actual penetration. So I've made this diagnosis of vaginismus. Remember what vaginismus is? Is the body's automatic reaction to the fear of some or all types of vaginal penetration. Whenever penetration is attempted, your vaginal muscles tighten up on their own. You have no control over it. Occasionally, you can get vaginismus even if you have previously enjoyed painless penetrative sex. So, in other words, you can't control kung mag-spasm or mag-contract yung vaginal muscles mo sa vaginal wall or canal. Kasi it will just contract, it will just tighten up, especially kung yung partner mo is going to penetrate you. And for some, that is very serious. So with that particular patient that I've seen a few days ago, I've diagnosed her with vaginismus. And what are the treatment of vaginismus? Most of the time, the treatment for vaginismus is psychological therapy. For the most part, some therapy to relax the muscles is what's required. And your doctor may recommend vaginal dilators too. These generally come as simple plastic tubes or gradual sizes that you insert into your vagina. Specialist sexual counseling is also commonly advised. Treatment actually focuses on managing your feelings around penetration and exercises to gradually get used to penetration. Some of these therapies are psychosexual therapy, a type of talking therapy that aims to help you understand and change your feelings about your body and sex. relaxation techniques, mindfulness, breathing, and gentle touching exercises to help you learn to relax the vaginal muscles. Pelvic floor exercises. This involves squeezing and releasing exercises to gain control of the vaginal muscles. Sensate focus. This involves exercises to help with your relaxation during sex and increase your sex libido. But remember, this therapy is usually done under the guidance of a specialized therapist. You will then usually expected to practice these exercises at home. If you are in a relationship, you can then choose to include your partner in some of these exercises. There you go, guys. Thank you for watching this video, and I hope you've learned something about one of the issues that women suffer, especially when they get intimate with their partner. Salamat sa panonood, and hopefully you will like this video. Give this a thumbs up, comment, and share it to your friends and to your families. Until next time, thank you, stay safe, and be healthy.